Every 8 seconds, someone in the world dies from diabetes. But here's what most people don't know. Your body starts screaming warning signs years before a diagnosis. The problem? We've been taught to ignore them. What if I told you that the tingling in your feet, the constant trips to the bathroom, or that unshakable thirst aren't just normal aging or stress? They're emergency signals from your body, desperately trying to tell you something is seriously wrong. Welcome back to BioWell Hub, where we break down the science of staying healthy so you can take control of your well-being. Today, we're diving into the 5 critical warning signs that your blood sugar levels are dangerously high. These aren't vague symptoms you can brush off. These are red flags that demand your attention right now. Stick with me until the end because the 5th sign is something doctors say most people completely miss until it's almost too late. Let's start with the most common sign that almost everyone ignores: excessive thirst and urination. Now you might think drinking more water is healthy, right? But when your blood sugar spikes, your kidneys go into overdrive trying to flush out the excess glucose through your urine. This creates a vicious cycle. You urinate more frequently, which makes you dehydrated, which makes you incredibly thirsty, which makes you drink more, which makes you urinate even more. If you waking up multiple times at night to use the bathroom, or you feel like you can never quite quench your thirst no matter how much water you drink, your body is waving a giant red flag. This isn't just inconvenient. It's your kidneys literally working overtime to save your life. The second warning sign is unexpected weight loss despite eating normally or even more than usual. This sounds like a dream come true for many people, but it's actually terrifying when you understand what's happening. When your cells can't access glucose because of insulin problems, your body panics and starts breaking down muscle and fat for energy instead. You're literally wasting away from the inside while eating plenty of food. The glucose is in your bloodstream, but it can't get into your cells where it's needed. So you're simultaneously starving at the cellular level while having too much sugar in your blood. If you've dropped weight without trying and you're eating the same or more, don't celebrate. Get your blood sugar checked immediately. Warning sign number 3: extreme fatigue and weakness that doesn't improve with rest. We're not talking about feeling tired after a long day. This is the kind of exhaustion where getting out of bed feels like climbing a mountain, where simple tasks leave you completely drained. This happens because your cells are being starved of glucose, their primary fuel source. Even though there's plenty of sugar in your bloodstream, without proper insulin function, it's like having a full gas tank but no way to get the fuel into your engine. Your body is running on empty while drowning in sugar. Many people chalk this up to stress, poor sleep, or getting older. But combined with other symptoms, this fatigue is your body's way of telling you it's in metabolic crisis. The 4th sign is blurred vision that comes and goes. High blood sugar causes the lens of your eye to swell, changing its shape and affecting your ability to focus. You might notice your vision gets blurry after meals or at certain times of day. Some people rush out and get new glasses, only to find their vision changes again weeks later. This isn't an eye problem in the traditional sense. It's a blood sugar problem affecting your eyes. Left unchecked, chronically high blood sugar can lead to diabetic retinopathy, where the blood vessels in your retina become damaged, potentially causing permanent vision loss. If your vision has been doing this weird fluctuating thing, it's not just stress or screen time. It's a metabolic emergency. Now for the 5th and most overlooked warning sign: slow healing wounds and frequent infections. When your blood sugar is chronically elevated, it damages your blood vessels and impairs your immune system. That cut on your hand that should have healed in a week is still there 3 weeks later. You're getting yeast infections or urinary tract infections repeatedly. Your gums are inflamed and bleeding. Men might experience recurring skin infections or jock itch. Women might notice persistent vaginal yeast infections. High glucose levels create the perfect environment for bacteria and fungi to thrive while simultaneously weakening your body's ability to fight them off. This is why people with uncontrolled diabetes are at much higher risk for serious infections and complications from minor injuries. Here's the bottom line: your body doesn't speak English, but it definitely speaks through symptoms. These 5 warning signs are not subtle suggestions. They're alarm bells. If you're experiencing even 2 or 3 of these symptoms together, it's time to see your doctor and get your blood sugar tested. Early detection can prevent serious complications like heart disease, kidney failure, nerve damage, and vision loss. At BioWell Hub, we believe knowledge is power, and your health is your greatest wealth. Don't ignore what your body is trying to tell you. If this video opened your eyes, hit that subscribe button and share it with someone who needs to hear this message. Your body is talking. Are you listening?